If you've ever felt uncertain about which medication might help with erectile dysfunction, or if you've heard the names Viagra and Cialis but aren't quite sure what the difference is, then this conversation is for you. Well, I'm Dr. Nerea Wolf, urologist and pelvic surgeon, and if you're navigating questions about erectile health, treatment options, or simply want to understand how these medications work, I want you to know you're in a safe space. We're here to help you make informed decisions about your body with clarity, confidence, and without judgment. Today, we're going to talk about two of the most commonly prescribed medications for erectile dysfunction: Sildenafil, which you might know as Viagra, and Tadalafil, which is often called Cialis. We'll explore how they work, what makes them different, and how to figure out which one might be the right fit for you. So let's take a deep breath and walk through this together, because understanding your options is the first step toward feeling like yourself again. Before we dive into the medications themselves, I think it's really important to understand how an erection actually happens. Because once you understand the process, the way these medications work will make so much more sense. How does an erection happen? An erection isn't just a physical response. It's a beautiful, complex coordination between your brain, your nerves, your blood vessels, and your hormones. Here's how it unfolds. Step 1. Arousal. It all starts with arousal. You see something, hear something, smell something, or feel something that excites you. Maybe it's a touch, a thought, or just being close to someone you're attracted to. That arousal sends a signal from your brain, down through your nerves to the blood vessels in your penis. Step 2. Nitric oxide is released. Once that signal arrives, your body releases a chemical called nitric oxide. Think of nitric oxide as the ignition switch for an erection. Without it, the process simply won't start. Step 3. Blood vessels relax and fill. Nitric oxide triggers the release of other chemical messengers, one of the most important being something called cGMP, cyclic guanosine monophosphate. These messengers tell the smooth muscles inside the penis to relax. When those muscles relax, blood flows in, filling the spongy erectile tissue. At the same time, the veins that would normally drain blood away get compressed, trapping the blood inside. The result? A firm, lasting erection. Step 4. The erection ends when arousal fades, or after ejaculation, your nervous system shifts gears. The muscles contract, blood flows back out, and the penis returns to its resting state. The chemical messenger cGMP also starts to break down naturally, helped along by an enzyme called phosphodiesterase type 5, or PDE5 for short. So where do medications come in? This is where Sildenafil and Tadalafil enter the picture. Both of these medications work by blocking that PDE5 enzyme, the one that breaks down cGMP. By blocking it, these medications allow cGMP to stick around longer, which means the blood vessels stay relaxed, blood flow continues, and erections become easier to achieve and maintain. In other words, these medications don't create an erection out of nowhere. They enhance your body's natural response to arousal. You still need that initial spark, the desire, the touch, the connection. The medication just helps your body follow through. Why do people need help with erections? Erectile dysfunction is incredibly common. It affects millions of men, and it can happen for so many reasons: stress, anxiety, fatigue, diabetes, high blood pressure, heart disease, hormonal imbalances, medications, or simply the natural aging process. And here's what I want you to hear. This is not a reflection of your masculinity or your worth. It's a medical condition, just like high blood pressure or high cholesterol, and just like those conditions, it can be treated. Now let's talk about these two medications specifically, what they are, how they work, and what makes them unique. Sildenafil, Viagra. The original Sildenafil has a fascinating origin story. It was originally developed in the 1990s as a treatment for high blood pressure. Researchers were conducting clinical trials to see if it could help lower blood pressure. And honestly, it didn't do much for that. But what they did notice was that the men in the study started reporting something unexpected: stronger, firmer erections. And that's how Viagra was born. Sildenafil has been around the longest, so we have decades of data on its safety and effectiveness. It's been studied extensively, and it works for about 60 to 80% of men who try it. How to take Sildenafil? You'll want to take it about 30 minutes to an hour before you plan to have sex. And here's an important detail. It works best on an empty stomach. If you've just had a heavy, high-fat meal, the medication won't absorb as effectively, and you might not get the full benefit. A light meal is fine, but try to avoid anything too greasy or rich. How long does it last? Sildenafil stays active in your bloodstream for about 4 hours. That doesn't mean you'll have an erection for 4 hours. It means that during that window, if you become aroused, you'll be more likely to achieve and maintain an erection. Dosing options. Sildenafil comes in doses ranging from 25 mg to 100 mg, and your doctor will help you figure out the right dose for your body. It's only available as an on-demand medication, meaning you take it right before you need it, not as a daily pill. Side effects unique to sildenafil. The most notable side effect is a temporary change in color vision. Some men report seeing a blue-green tint or noticing that colors look a bit off. If this happens, stop taking the medication and talk to your doctor right away. Another occasional side effect is nosebleeds, though this is relatively uncommon. Tadalafil, Cialis. The longer-lasting option. Tadalafil was approved in 2003, so it's a bit newer than sildenafil, but it has some distinct advantages that make it a favorite for many men and their partners. How is it different? Tadalafil is what we call a more selective PDE5 inhibitor. That means it's more targeted in blocking the enzyme responsible for breaking down cGMP, which can result in fewer side effects for some people. How to take Tadalafil. Like sildenafil, you take it 30 minutes to an hour before sex. But here's the big difference. Tadalafil lasts up to 36 hours in your system. That's a full day and a half. For many people, this creates a sense of spontaneity. They don't have to time things as precisely, and they can have multiple intimate moments over a weekend without needing to take another dose. Daily dosing option. Unlike sildenafil, Tadalafil also comes in a low daily dose. Some men prefer this because they can take a small pill every single day and not have to plan ahead. It's always in their system, ready to work whenever the moment feels right. Dosing options. For on-demand use, Tadalafil comes in 5 mg to 20 mg doses. You might notice that's lower than sildenafil's dosing, but don't worry, it's not less effective. It's just formulated differently. Bonus benefit helps with urinary symptoms. Here's something really interesting. The low-dose daily version of Tadalafil is also approved to treat benign prostatic hyperplasia, BPH, a condition where the prostate gland enlarges and causes urinary symptoms like difficulty starting urination, weak stream, frequent nighttime trips to the bathroom, or a sense of urgency. So if you're dealing with both erectile dysfunction and urinary issues, Tadalafil might be able to address both problems with a single medication. Side effects unique to Tadalafil. The most commonly reported side effect is muscle aches or back pain, which usually resolves on its own within a day or two. Side effects common to both medications. Before you start either of these medications, there are some important safety considerations to keep in mind. Common mild side effects: headaches, flushing, warmth or redness in the face, nasal congestion, heartburn, mild vision changes. These are usually temporary and tend to improve as your body adjusts to the medication. Critical warning: do not take with nitrates. This is extremely important. If you take nitrate medications, such as nitroglycerin for chest pain, angina, you cannot take sildenafil or Tadalafil. Combining them can cause a dangerous drop in blood pressure that could be life-threatening. If you have kidney or liver problems, or if you're taking other medications, make sure your doctor knows. Some drugs can interact with these medications, and your dose may need to be adjusted. Rare but serious side effects. Priapism. This is an erection that lasts longer than 4 hours. It sounds like a joke, but it's actually a medical emergency. If not treated quickly, it can cause permanent damage to the erectile tissue. Fortunately, this is extremely rare when the medication is taken as prescribed. Hearing loss. This has been reported in very rare cases. I've never personally seen it in my practice, but it's listed as a potential risk. Avoid over-the-counter supplements. Please be cautious about supplements or herbal products that claim to treat erectile dysfunction. Some of them contain unlisted sildenafil or Tadalafil, meaning you have no idea how much you're actually taking. This can be dangerous. Always get your medication from a licensed physician or pharmacy. So, Which medication is better? Honestly, both are excellent options. They're about equally effective. Studies show a success rate of 60 to 80% for both medications, but there are some nuances that might make one a better fit for you than the other. What does the research say? I want to share some data from a meta-analysis, a study that combines results from multiple clinical trials to give us a clearer, more reliable picture. This particular analysis looked at 16 studies involving over 5,000 men, comparing Sildenafil and Tadalafil head-to-head, using validated questionnaires that measure erectile function. What they found, efficacy was similar in both groups. Satisfaction was higher with Tadalafil. Men who took Tadalafil reported better self-esteem, more satisfaction with treatment, and better relationship quality. Partners preferred Tadalafil too. In 9 studies that asked about preference, both men and their partners leaned toward Tadalafil, likely because of the longer window and the sense of spontaneity it offers. Side effects were comparable, with one difference. Sildenafil users were more likely to experience vision changes, while Tadalafil users were more likely to report muscle aches. My recommendations. Here's how I guide my patients. If you have urinary symptoms related to an enlarged prostate, BPH, consider taking daily low-dose Tadalafil. It can address both erectile dysfunction and urinary issues at the same time. If you prefer spontaneity and a longer window, Tadalafil, on-demand or daily, might be a better fit. If you're trying medication for the first time, start with either one, and if it doesn't work as well as you'd hoped, don't give up. You can switch to the other option. Sometimes one works better for your body than the other, and that's completely normal. Always work with a doctor. These medications need to be prescribed and monitored by a healthcare provider. They'll make sure the dosing is right, check for potential interactions, and help you troubleshoot if something isn't working. Other treatment options. If medications don't work, or if you're looking for alternatives, there are other options, including urethral suppositories, intracavernosal injections, medications injected directly into the penis, vacuum erection devices, penile implants. Each of these has its place, and I'm happy to talk about them in future videos if you're interested. I know that dealing with erectile dysfunction can feel frustrating, isolating, or even discouraging. But I want you to hear this. You are not alone, and there is help available. These medications have changed the lives of millions of men, not just physically, but emotionally and relationally. They've helped restore confidence, intimacy, and joy. If you're considering treatment, I encourage you to have an open, honest conversation with your doctor. Bring your questions, your concerns, and your hopes. And remember, trying one medication and finding it doesn't work perfectly doesn't mean you failed. It means your body is unique, and we just need to find the right approach for you. You deserve to feel connected, confident, and fully present in your intimate life. And with the right support, that's absolutely within reach. Thank you so much for being here today. If this helped you, I hope you'll share it with someone who might need to hear it. And as always, remember to take care of yourself because you are absolutely worth it.